We are back with another series. Let's revise PYQs. This will benefit you in your upcoming exam. Let's look at the first question from this video. Question 1. In which of the following nerve injuries is the instrument shown below used? Your options are, and the correct answer is radial nerve. Here's the explanation.
These two things, cock-up splint. This is a dynamic or static cock-up splint. This is a dynamic cock-up splint. Dynamic cock-up splint. See, static, both these splints were the only indication, wrist drop. Wrist drop, okay, radial nerve palsy, wrist drop. If it's a neuropraxia, definitely we know that this will recover in 6 to 8 weeks. I have to do like this and put a static splint. It is in this position. It won't act. It will be like this permanently. Okay, at least in 24 hours they should wear, the book says you should wear for 20 hours. So then it will be effective. So this is called cock-up splint, a static or a dynamic cock-up splint. Look at here, a spring is there. You able to see? Two springs are there. Okay, right, what happens in wrist drop, patient can't extend, but they can flex. So what happens when the patient forcefully flex, no, extension is done by the spring. So this is called a dynamic cock-up splint. This is superior to a static cock-up splint. So both are the indications, they are used in wrist drop. Okay, so that completes the cock-up splint.
Question 2. A woman during her routine examination presents with the following X-ray finding. What is her most likely diagnosis? Your options are, and the correct answer is multiple enchondromas. Here's the explanation.
Enchondroma. This chondroma is otherwise called enchondroma. Enchondroma. Okay. This is a benign tumor which arises from the hyaline cartilage. This arises from the hyaline cartilage. Okay. This arises from the hyaline cartilage. It causes destruction of the cancellous bone. That's why the name N. N means inside. Exo means outside. Exostosis or osteochondroma which arises from the cortical bone outside. It's shown outside the bone. But this here, you see the destruction is happening inside the bone. That is in the cancellous bone. That's why since inside it's called enchondroma. This is called enchondroma and it arises from the hyaline cartilage. The peak age of incidence, don't take down this 50, no. This is the peak age of incidence 10 to 30 years. 10 to 30 years. Okay. It can happen anywhere in the body since it's a hyaline cartilage tumor. Most commonly, this is seen in phalanges of the hand. Phalanx of the hand, especially little finger. Especially little finger. 1000 times repeated MCQ. Please take down. Once in a DependB question, I remember very strongly, they had asked a question, most common bone tumor of hand and foot. This was the question. Answer is enchondroma. So, this is the most common tumor that is seen in hand and foot. Okay, enchondroma, that is called chondroma. Right. See, clinical presentation, 99% it is symptomless, no symptoms at all, asymptomatic. Sometimes this can present to you with pathological fracture. This can present to you with pathological fracture. Okay. So this is the clinical presentation. Very rarely it can, fracture means pain, swelling. Okay. So it presents as pathological fracture. Diagnosis. And one more point I want to tell you, enchondroma, this what we are discussing is solitary enchondroma. Sometimes there is a condition called multiple enchondromatosis. Multiple enchondromatosis. Multiple enchondromatosis. Chondromatosis. Enchondromatosis. The answer is given in all orthopedic textbooks. Already we had studied in pathology, Robbins also. This is called, multiple enchondromatosis is called Wolier's disease. Wolier's disease. Okay. Wolier's disease. Okay. Multiple enchondromatosis is called Wolier's disease. Wolier's disease is good or bad? Very bad. Why? 40% of them will undergo malignancy by 40 years of age. That's what the book says. Earliest disease, multiple enchondromatosis, high chance of going for malignant change. Chondrosarcoma, high chance of going for malignant change. Solitary enchondroma itself has very potential to undergo malignancy. When it is multiple enchondromatosis, otherwise called Earliest disease, very high chance of going for malignancy. That's what book says, no? 40% out of 100 cases, 40 cases will go for malignant change. So that is Earliest disease. If with multiple enchondromatosis, when the patients are associated with facial hemangioma, okay, enchondromatosis with hemangioma of the face, hemangiomas of the face, okay, it is called Maffucci syndrome. Okay, Maffucci syndrome. Okay, very important. So there are two variants of enchondroma. Simple enchondroma is one entity. Multiple enchondromatosis is called Earliest disease. Enchondromatosis with facial hemangiomas, they are called Maffucci syndrome. Okay, right. Then how to diagnose? Obviously our X-ray, when you take an X-ray, it will show you an expanded lytic lesion with wisp of calcification, very pathognomonic. You look at here, an expanded lytic lesion, we are able to see expanded osteolytic lesion, okay, with wisp of calcification inside it. See, you are able to see small, this is calcifications. Okay, calcification, this very pathognomonic. And one more thing, I will erase and I will show you just to follow. See, it is expanded, but nowhere you are seeing breaching of the cortex. There is no breakage in the cortex. See, the cortex is completely intact. Cortex is completely intact. There is no breakage of the cortex. This again is very characteristic. Okay, it's very characteristic, right? So there is no breakage of the cortex. And this calcification, some books uses a word, this is stippled calcification. Stippled calcification. Okay, some books uses a word popcorn calcification. Okay, so the type of X-ray changes you can see in enchondroma, it can be an expanded lytic lesion with wisp of calcification presenting inside, that can be called a stippled calcification or a popcorn calcification. One more thing, in one ortho book it is mentioned like this, okay, since it is like a ring, no, exactly, it's like a ring, this is called O ring sign, O ring sign. So these are the radiological features of enchondroma.
Question 3. An RTA patient presented to the emergency department with severe pain in the wrist. An X-ray was performed as given below. What is the best next step of management? Your options are, and the correct answer is neurovascular assessment and closed reduction and slab application. Here's the explanation.
See, radial styloid fracture is otherwise, you know, distal radial fractures. It can be a radial styloid. Distal radius means distal most portion of radius. You can get a styloid, radial styloid fracture. You can get a Colles fracture. You can get a Barton's fracture. You can get a Smith fracture. Okay, 4 types are there. Now we are going to see the radial styloid fracture. Radial styloid fracture is otherwise called Schaffer's fracture. Is otherwise called Schaffer's fracture. Why this is called Schaffer's fracture? It's very interesting. You know who is a Schaffer? Okay, Schaffer is a polished or a high class, whatever way, whichever way you can take. It's a Schaffer is an high class driver. Okay, it's a driver. Schaffer's fracture. So they're called drivers. Certain times, no, the names will change. Just like that, you can't. English is very peculiar language. Okay, so in certain areas you have to use certain words. For example, somebody in an office setup, somebody comes and cleans the area, you will use a word sweeper. Same thing happens in flight also. You can't use the word, it's called cabin crew. Like that, somebody who is just doing simple cooking on roadside, you will call him as a cook. The same guy, when he does in a 5-star hotel, is called a chef. Like that, Okay, somebody driving an ordinary Maruti car is called a driver. Somebody is driving a Merc is called a chauffeur. So the meaning is the same. Okay, words are different. So chauffeur means a driver. So chauffeur's fracture, why it's called a chauffeur's fracture? Why it's called a chauffeur's fracture? Very simple. Olden days, I am telling before Henry Ford's era. Henry Ford, you would have heard of Henry Ford. Okay, founder, director of Ford Car Company. He was the man who invented the ignition, self-starter. Before him, there was no self-starter. So how to start a car? A chauffeur, a driver has to go in front of the car, in front of the bonnet, outside the car, through a hole. No, they'll put a rod. It's called handle. You would have seen this in some vintage English movies like Titanic. So you have to put a handle. You have to start a car like this, like a generator. Once the engine got started, it will give a backfire directly that will come and hit the radial styloid. So before self-starter era, drivers very frequently, daily, they were developing this fracture. So this was called a chauffeur's fracture. It's very interesting. First, it was demonstrated by the great Hutchinson. So it's called Hutchinson's fracture, otherwise called a backfire fracture. So what are the other names of radial styloid? It's called chauffeur's fracture. It's called Hutchinson's fracture. It's called backfire fracture. Okay, look at this. Very simple, right? See, the styloid alone got fractured. Very simple. Treatment, again, it's very simple. This fracture is best treated by closed reduction and below elbow POP cast. Suppose the chunk is very big and it's unstable, better you just give a percutaneous K-wire, then you apply a BE below elbow POP cast. That's enough. Not a great procedure is needed for this. The best management is closed reduction below elbow POP casting. If the fracture is unstable, percutaneous means through the skin you are doing, you are not opening. Percutaneous K-wire fixation with below elbow POP casting. Okay, that completes radial styloid fracture.